Hello and welcome back to our Gut Health Beat the Bloat series for June. And today we are talking about infections in the gut that might be related to your bloating, IBS, anxiety, acid reflux, diarrhea, constipation, autoimmune conditions like colitis and Crohn's, all of those things. So some of the biggest infections that are most likely related to gut issues but are commonly missed include Epstein-Barr virus, which is commonly known as mono, cytomegalovirus, CMV, of course, Lyme, and then parasites. And now everybody likes to jump on the parasite trend and just do parasite cleanses, and there's a lot of debate about that as well. And then a lot of things that other people come and tell me is that, oh, I have to have yeast. It's got to be yeast. I have all the things. I have the white tongue. I have this. I have that. I looked on this blog. I have all of the symptoms. And what's really, really hard about infections from a functional medicine perspective, in my opinion, is that when we read these lists of symptoms and we go, here's the symptoms for Candida and yeast, here's the symptoms for Epstein-Barr, here's the symptoms for Lyme, they all kind of look like each other, right? So it's really hard to say, like, definitely you must have yeast. Yeast is causing all your problems. Stop eating sugar. Do the Candida diet. You'll be cured. You'll feel so much better. When that's actually probably not the case. Now, before I jump into this, I also want to talk about biofilm, which is a really, really common thing. And it's a really interesting concept and something that's relatively new to our understanding of our gut. And what biofilm is, I kind of call it like a tent that bacteria, viruses, fungus, yeast, mold, parasites, protozoa, they kind of make a little house in our gut, and our immune system can't penetrate through it. So everybody kind of gets together and hangs out, and sometimes they sneak out and wreak havoc and cause all kinds of problems, and then they kind of build on top of each other. And so what happens when, say, you do a 3-day detox or a 10-day, pick a detox, right? And you're feeling okay, and then day 3, you're like, oh my God, I'm gonna die. Why did I do this? I'm so much worse. I feel like death. Everything's coming out. Maybe you're throwing up, right? Things are bad. And the reason is you're bursting open that biofilm, which is why when you do a detox or a program or a parasite, name whatever it is, you want to add in a binder like activated charcoal or GI detox or something like that. So make sure that you're drinking plenty of water, you're adding in a binder. Now you know that when you feel bad, that you're probably doing the right thing. And as that biofilm breaks open, I also have biofilm supporters that I use that help bind and help get out all the excess bacteria and things like that. So what I do recommend is doing a test called the GI map, which is from Diagnostic Solutions. A lot of people are really familiar with the GI effects from Genova Diagnostics. Both are great. There's lots of labs out there because you don't want to guess. And a lot of people who've come to me who says, oh, I have yeast, they have absolutely no yeast. Or people who are saying, I'm sure I have no yeast, but I think I have this. Like, we have no idea. And GI map tests almost always surprise me because they give us a lot of information. What I did is I pulled up my previous GI map. Now, is it a sexy test to talk about? No. Gut health, not the sexiest thing to talk about. What happens is you get a test mailed to your home. You go to the bathroom and you collect your stool. You put what's in there into the little cup. Yes, it comes with gloves and a biohazard bag, all of that good stuff. You seal it in your little bag. I do believe you're either supposed to freeze it or refrigerate it before you send it off in its prepaid package back to the lab. Don't send it back to me. I don't want it. I can't do anything with it. And then we get a report back. And you can go to Diagnostic Solutions laboratory.com or just Google GI map. It'll come right up and give you an example of what a GI map, exactly what it tests for. We're going to talk about that today and a couple tricks of things that I do. So number one, it looks at our typical pathogens like C. diff, which is really common, E. coli, salmonella, things like that. It has hundreds of things that it tests for. It looks at parasitic pathogens, viral pathogens, and it looks at H. pylori, Helicobacter pylori. Now, this is one that most people miss because we have all these bacteria in our mouths, our stomach, our digestive tract, and there's no such thing as good or bad, right? They live within us, and they're supposed to be in harmony and balance. So we say good bacteria, we just mean healthy bacteria. We say bad bacteria, but really what we mean is opportunistic bacteria. And then we have infections like C. diff, Epstein-Barr viruses, pathogens, things like that. So, I've done a lot, and especially for kids, because they shouldn't be having, I've caught a lot of H. pylori and parasites and worms in kids. So these are things that we have to watch out for. And then rather than spending all of the money and all of the time, and honestly, the pain and discomfort of going through a 10-day, 20-day, 50-day, 60-day cleanse where you're spending hundreds of dollars for something you might not even be touching, right? Like you might be treating H. pylori because you're convinced that's where your reflux is coming from, but in fact it's Epstein-Barr or Lyme, and we're on the totally wrong path. So testing really is important when it comes to your gut before you jump on these things. It has commensal or keystone bacteria, which is what we call our good bacteria. I always write happy faces on there. And then the opportunistic or overgrowth bacteria, where we have normal strep, normal staph, normal pseudomonas. However, we don't want those being overgrown and disrupting that balance and causing infections and immune reactivity, either too high of immune response or too low immune response. It also looks at autoimmune related bacteria, which is great, and fungus, yeast, viruses, including cytomegalo and Epstein-Barr. However, those are more going to be accurately tested through blood work with the entire panels rather than using just the GI map. However, it's a great option. It looks at parasites, including protozoa, worms, and eggs. So it's not only just looking for worms, which a lot of labs do, but it also looks at the DNA and basically does a PCR to see what's going on, I believe, in your stool. So a lot of times I just do a look and go, oh, I don't see anything white crawling around. You don't have worms. That might not necessarily be true. There could be eggs. It could be microscopic. We still have to see what's going on in there. So there's tons on there. As I'm scrolling through my tests, I didn't have any, which was great. And then the last page of the GI map is my absolute favorite because it looks at our intestinal health marker. So it looks at steatocrit, so how well are we breaking down our fat. It looks at elastase, which is one of our pancreatic enzymes, so how well are we digesting our food. It looks at beta-glucuronidase, which is also an enzyme that helps with estrogen, breaks things down. It looks at occult blood, which is something that's really common. So a lot of people don't realize, especially women who have internal hemorrhoids that are bleeding and causing a lot of problems, that we can take care of either naturally or with suppositories, or it could be a great marker to say, hey, you definitely need a GI referral. We need to take a look at where is this blood coming from. It could be Crohn's, colitis, it could be just hemorrhoids, it could be it could be anything on that scale. We want to make sure that you're okay. It also looks at our immune response. So secretory IgA is part of our immune system that covers all of our mucous membranes. So our nose, our sinuses, our mouth, our throat, our lungs, and our entire digestive system. So if that's too low, your immune system's shot. We need to bring that back up. If it's too high, it's telling us that there's an overgrowth somewhere, and we always see that, and it's fighting, and at some point it's going to get worn down. So we need to be able to support that. And it also looks at eosinophil activation protein to tell us if there's some allergies going on that we need to be aware of. This test also looks at calprotectin, which is a marker for inflammation in your stool, and is one that they look as one of the major cancer diagnoses, as well as things like Crohn's and colitis. So it's a great marker to have as well. And then they have a lot of add-on tests like zonulin to test for leaky gut. So we have all these things. So once we figure out, we can go, oh, it's H. pylori, it's not yeast. Or we can go, oh, it's actually parasites, it's not bad bacteria, right? And then we can narrow down our perspective. So if you don't want to do the test or something else, or you know you have Epstein-Barr. So for me, I know I have Epstein-Barr. I've had it basically every year. You know, they used, when I was growing up, they said, oh, you can only get mono once, and then come to find out that it lives in our body forever, and you can have it be reactivated. So that was a bummer to find out. So I had it first when I was 16, and then again, I had it twice in college, and then once I started getting really sick with colitis, I have a Epstein-Barr flare now twice a year. How fun is that? So one of the main things that I use, I love Dr. Kasha Kine's book. She has the Epstein-Barr virus solutions. She has some great programs and things like that. She has meals and work in your kitchen and sleep and stress and toxins and all of these great things. And this is great for Epstein-Barr. I do use a lot of her recommendations. One of the other things that I find so interesting is that I use DiBarto, which is a homeopathic company that I use their symptom series, and it has vials 1 through 10, and it's basically a homeopathic for the Epstein-Barr virus. And now they have this for a lot of different things, cytomegalo, Lyme, bacteria, strep, things like that. So when I do have my reactivation, it helps with the symptoms. And the first time I did that series, my colitis symptoms flared like crazy, because I was like, wow, this is where it's living. You know, Epstein-Barr likes to hide in our gut, our liver, and sometimes our brain and our thyroid, because it's one of those forever viruses. So if you find that you have chronic thyroid problems, it could be related to mono, and doing these types of homeopathic works along with the nutritional stress and sleep and everything else that we need to do can help your body mount a better response to that virus. So the more often that I do that, the quicker I recover. You know, sometimes you're down for 2 months and then 6 weeks, and then you find like it just gets easier and easier. So that's one thing that you can do. The other things that I recommend doing, which are really, really, really general, but great for overall gut health. So we have 2 products from doTERRA. We have the GX Assist and the PV Assist. Now, the GX Assist is great because it has oregano, tea tree, lemon, peppermint, lemongrass, and thyme, and caprylic acid. And we know that these things are great for eliminating the things that we don't want in our body. And so what I like to recommend is a pulsing technique. So depending on your ability to remember, and this is not to be mean to anybody, but I used to do, say, 10 days on, 10 days probiotic. So we're doing 10 days of GX Assist, 10 days of PV Assist, and just kind of pulse for 3 times. And then because there's 30 PV Assist and 60 GX Assist. So you want 2 bottles of the PV Assist. And that should get you through basically anything that is on that list. Now, a lot of people have told me 10 days is weird because it's like ends on a Tuesday and then starts on a Thursday. Like, it's too much. So I kind of switched it to maybe 1 week on, 1 week off, if that's easier for you. So you switch on Sundays might be better, or do 15 days and then 15 days. So half of the month and half of the month. So whatever works for you. It's funny because when I started functional medicine, I felt like I was the only one pulsing. Everyone I was learning from said, don't pulse, just, you want to go hardcore, like, herbal support on one side for 30 days, get rid of everything, and then you can put in probiotics and everybody will feel better. Well, when I was doing that, I was like, oh my God, I'm so sick for 30 days. My body needs a break. I don't want to do this anymore. And now, the last continuing education course I was at, they're like, actually, we've done some research and we found that pulsing gives the body a break. So we get rid of that biofilm, release some things, and then allow the gut to recover, the immune system to take a deep breath in, refeed with probiotics and some immune support, rebuild that support, and then go, okay, let's attack again, and then pull back and then help rebuild. So this pulsing effect of on and off can help. And it also goes a little bit slower, so you're not like running to the bathroom, you don't have any accidents, things like that. And then, of course, I always recommend my Digestin just right on the belly, just to help reduce any discomfort, any gas, any bloating, things like that. And then I do use Melissa essential oil, 2 drops under my tongue every single day as a general support. I'm trying to avoid using really specific terms because I can't make any claims. As we all know, the only thing that can treat, prevent, or cure is surgery and drugs. And if you just happen to feel better with Melissa under your tongue, whether that's emotionally, physically, immunology wise, then that's wonderful and great for you. So that is my basic protocol. But if, like I said at the very beginning, if you're struggling with GI symptoms and they're not getting better with enzymes, not getting better with probiotics, they're not getting better with elimination diets, there's probably a hidden infection somewhere going on. Check out that GI map, and I can order that for you if you're a patient. If you want to become a patient, go to my website, schedule online, and we will get you taken care of. All right, I hope this was helpful. If you have any questions, comments, thoughts, I'd love to hear them. Comment below, let me know what's going on for you, and we'll see you next time.